Hi everyone, Dr. Macy here once again. So today I've been asked about my approach to a patient with hypertension. Once again, lifestyle is at the core of treating someone with hypertension. First, some parameters. What is hypertension? The top number, or systolic, when it's over 130, that's considered hypertension. The bottom number, diastolic, when it's more than 80, that is considered hypertension. And there's a stage 1 hypertension when the top number goes up to 149, and stage 2 if it goes above 150. So, when you have hypertension, otherwise called a silent killer, you may have problems down the line. You may not have symptoms right away, but you for sure will have them. So my approach is very simple. Lifestyle with an appropriate diet that is predominantly a plant-based diet. A Mediterranean diet is probably the best approach, since that is the diet that has the most literature behind it in the best journals in the world. And so we want to make sure that you consume plenty of vegetables and legumes, plenty of whole grains, plenty of fruit, and limit to appropriate portions your meats. And people ask me about the red meat. If you have hypertension, you should consume no more than 2 or 3 servings of red meat per week, and each serving no more than 6 ounces, which is approximately the size of your palm. So again, no more than 2 or 3 servings per week of the red meats. And what else? Salt restriction. Perhaps 2 to 3 grams per day is more than enough. So you should always be aware of the servings that contain sodium, such as when you go to restaurants or canned goods or other foods that come in bags that have a lot of sodium. Beware for those. Lastly, exercise. You need to walk at least 30 minutes or more. Some people advocate 10,000 steps. I like to say just be active 5 times a week or more. Try to take advantage of the beautiful weather like we have here, and or make sure you go to the gym if you like that. If you want to do resistance training 2 or 3 times a week for 20 or 30 minutes, that's also great. Lastly, some patients require medications, especially as we age. So what are the best medications? They belong to 3 or 4 groups of drugs that have great data behind them. The ACE inhibitors, the angiotensin receptor blockers, or ARBs, the calcium channel blockers, and the beta blockers, as well as the hydrochlorothiazide or chlorthalidone type diuretics. Those are the mainstays of the pharmacopoeia relating to the treatment of hypertension. And your doctor will know which one may be best for you depending on other circumstances that you may have as well. So, in essence, the summary of treating hypertension involves lifestyle, which means diet, exercise, de-stressing with a variety of activities that mitigate your stress, proper sleep, 7-8 hours of uninterrupted sleep, and medications, as I mentioned, when needed. Hopefully, if you also have some weight to shed and you lose a few pounds, you may in fact be able to get off some of these medications and control your hypertension with lifestyle alone. Once again, Dr. Fred Macy. Hope you enjoy this.